It's a case control study that we've been doing at the Durham VA hospital. So we collect men undergoing biopsy. We give them a questionnaire, tell us about your food intake, and we also get healthy control, men who've had an opportunity to be screened for prostate cancer. So they've had a PSA test, but were not recommended to go have a biopsy. So the healthy controls versus the men undergoing biopsy. And the men undergoing biopsy, we select those that had cancer on the biopsy. So we have men with cancer, healthy men without cancer. And when we looked at their dietary patterns, we thought what we'd expect to see is that carbohydrates, because they raise insulin, that more carbohydrates lead to higher cancer risk. We actually saw the opposite. Quite surprising to us that the more carbohydrates, the lower the risk of cancer. But importantly, we also saw some evidence that the glycemic index, which is a measure of how simple the sugars are, so more of the cookies and cakes, would get a higher score, whereas your grains and whole grains and your fiber would get lower scores. So higher scores seem to perhaps increase risk. And then also fiber seemed to be protective. So it's not just a simple eat more carbs, you're going to be fine, but you got to eat more of the right carbs.